We're going to start a little bit early with the presentation today because we got a lot to talk about. So just wanted to do a few announcements before our speaker. Just to let you know that next week on Wednesday, we do have our Halloween party. If you're not already signed up for that, please consider doing so. We do have door prizes and other prizes available for that. So that's Wednesday at lunchtime for the Halloween party. November 1st, which is next Thursday, we are having free bingo game. We have lots of prizes for that. That's sponsored through the VFW in Uxbridge. They're actually sponsoring this bingo game for us. Should be a great event. There's lots of prizes available. That is during lunchtime as well on November 1st, which is next week on Thursday. So please consider coming to that. That will be a longer bingo game than what we usually play. And transportation will be available after the bingo is finished. So please consider joining us for that. And then next Friday, the Chief of Police is back to talk to us. It's another lunch and learn on Friday, November 2nd during lunch. So please consider joining us for that. So busy week next week. Okay, so Ed Roth is here today. Ed is a representative from the SHINE program. It's a health insurance counseling program, free of charge for folks. I'm happy to announce that the Uxbridge Senior Center will now have a SHINE representative available. Pat Nectow, who's in the back. Pat, wave your hand so everyone knows. Actually, Pat's going to be here on Tuesdays in the morning to be a SHINE representative for us starting next week. So if anyone has any questions about their health insurance, if they want to meet with Pat, she would be glad to meet with you and kind of go over your personal health insurance program and just make sure that it's meeting your needs. If you have any questions or concerns, she will be available to us and she'll be a valuable resource to us. So I'm happy to announce that. So welcome, Pat. Thank you. All right, so let's welcome Ed Roth from the SHINE program. He's going to talk to us today. Thank you, Ed. And just one more thing, we will be serving lunch to the tables at noontime, so no one needs to get up to get their meal today. We're going to serve it right to the table, okay? So you can continue to listen to Ed's presentation.
Hi, how are you? Good to be back in Uxbridge, it really is. We do this thing every year, and I want to welcome Lisa. I know she's been here for a little while, but I had the opportunity to welcome her, and it's good to have her with us. And we're excited once again to be able to provide some regular SHINE service here at the Senior Center. And we'll be doing that effective, I think, next Tuesday. Pat Nectow, who has been doing counseling for the area up at the Tri-River Health Center, she's gonna be doing it down here at the Senior Center. So people can take advantage of that, and in order to get an appointment, you just have to call the Senior Center and ask for a SHINE appointment, okay? And I'm sure Lisa and her staff will put you on Pat's schedule. All right, so that's great news. Today, I wanted to take an opportunity to review any of the changes coming up for Medicare for 2019. Okay, there are some changes, not many, but there are a few changes folks may be interested in. And we do this every year, so just to let you know that annual open enrollment is now in effect. Medicare annual enrollment is October 15th through December 7th each year. And if you make a change, it's effective on January 1st. Medicare Advantage open enrollment is from January 1st to March 31st, 2019. This is a new open enrollment. We'll talk a little bit about it as we go through the presentation. Federal employees, if you're a federal employee, they have their open season, they call it. I don't know if it's about hunting or what it's about, but it's about their health plans. And that runs from November 12th through December 10th of every year. And the effective date, again, is on January 1st. And the Health Connector is for the Mass Health Connector, and it's for November 1st, 2018 through January 23rd. That's for folks that are on connector plans, or as many call them, Obamacare plans, that folks that are still working or not working get insurance through the state. A little bit about Medicare, about cost sharing for 2019. First, if you haven't heard, you're going to get a little bump in your Social Security check, 2.8%. You can take that to the bank. So that's good news for some, bad news for others. I don't know. But as you know, when you get a little bump in your Social Security check, Medicare's get a little bit out of the bump. So first thing I want to say is that your Part B premium been $134 for the past couple of years. It's going up, but only $1.50. It's only going to go up to $135.50. So that's not bad. They could have got more out of us. So we're happy about that. So your Medicare premium, your monthly premium coming out of your Social Security check is going to be $135.50. Now, the other deductibles that I have them in here, I want to go over them briefly. If you just have Medicare Part A, you don't have any other coverage, okay? I call it original Medicare. If you have original Medicare, the inpatient deductible is going to be $1,364. Again, if you have just have original Medicare, your Part B deductible will be $185. And that Part B deductible is when you, at the beginning of the year, you have to pay the first $185 out of pocket for your Part B when you go see the doctors or have a test or something. The Part D deductible, the drug deductible this year is going to be $415, and the initial coverage limit of the donut hole, when you're at the donut hole, $1,328. And the Part D out-of-pocket threshold will be $5,100. Part D catastrophic cost sharing is when you get out of the donut hole, it's going to be $340, $850 for your medications. These prices and these costs really don't affect a lot of us because we have other insurance. A lot of us have other insurance, okay? So they don't really affect a lot of us. There is something I need to mention. Medicare now has a Medicare Diabetes Prevention Program. It's called an MDPP. It has free preventive benefit for people with Medicare who have been diagnosed with pre-diabetes. So they'll be able to get blood tests from their doctor to identify high blood sugar. They can enroll in an MDPP with an organization that is a Medicare-approved supplier, and CDC-approved curriculum that includes training on dietary change, increased physical activity, and weight loss strategies. And there's a website somebody can visit if they want to get more information. That's just something I have to tell you about. It's a new incentive by Medicare. Okay, so I just wanted to mention that. Medicare supplement plans, Medigaps. Medigaps are we're familiar with them. A lot of us have Blue Cross Blue Shield, MedX Bronze, or Supplement 1, we know it as. And what that plan does, it pays what Medicare doesn't pay. Now, the Medigap Core plan, and there's two types of plans. There's the Core plan, and the cost of the Core plans for this year will be $98.42 up to $163.45. And the Supplement 1 plan premiums will be going from $197.74 to $260.51. Now, these plans, again, they're the plans that will cover what Medicare doesn't pay. The Core plans don't cover those deductibles I talked about. The Supplement 1 plans do cover the deductibles I talked about. So if you have a Supplement 1 plan, a Blue Cross Bronze or MedX program, you're not going to see any bills from your doctor if you're paying that higher amount, okay? There's 7 companies that sell Medicare supplement plans: Blue Cross Blue Shield of Massachusetts, Fallon Health, Harvard Pilgrim, Health New England, Humana, Transamerica, Tufts, and United Healthcare. It's all identical coverage. They're regulated by the Commonwealth of Massachusetts. And the cheapest plans, believe it or not, are the Blue Cross plans. Okay, so again, you're going to get identical. This coverage is all the same. So if you have one of these Blue Cross plans, you have very good coverage. All right? Now, this year, starting in January, there's a new Medicare MAPD open enrollment period. It used to be that if you had a Medicare Advantage plan, like a Tufts plan or a Fallon plan, a Blue Cross Blue Shield PPO, you had a Medicare Advantage plan disenrollment period, okay? And that ran from January 1st to February 14th of every year. They've done away with that plan, done away with that program. Okay, so that is no more. So what you have now is this Medicare Advantage plan open enrollment period. So you must be in a Medicare Advantage plan, a Tufts, Fallon type plan, Blue Cross Blue Shield, HMO, or PPO, or a United Healthcare plan in order to use this particular period. Okay, it can be used once. Okay, new beneficiaries who enroll in Medicare Advantage during their IEP can use the MAOEP during the first 3 months they have Medicare to make a change if they so choose. Okay, now let me tell you what you can do. Beneficiaries in an Medicare Advantage plan on January 1st can switch to another Medicare Advantage plan with or without drug coverage as part of the MA plan. They can leave Medicare Advantage and join Original Medicare, coordinating and getting a separate Part D enrollment plan. And prior MA plan is canceled with the enrollment in a new MA plan or into a new Part D plan with Original Medicare. So you can make changes now that you couldn't make before. Okay, these changes you couldn't make before. You could always get out of the Medicare Advantage plan and enroll in a Original Medicare and pick up a Part D plan, a drug plan, but you couldn't switch to another Medicare Advantage plan. Now you can. So if you're in a Fallon plan and you want to switch to a Tufts plan, you can do that during this period. And it's a longer period, too. It goes from January 1st all the way until the end of March. Okay? You follow me on that? Okay? I'm going to get questions later, okay? So, or I can get them now, but I'll get questions later. Okay? Everybody hear me all right? Oh, beautiful. So, we talk a little bit about Medicare Advantage plans, okay? So, Medicare Advantage plans are those types of plans where you join the plan, Fallon, Tufts, a lot of us have Fallon or Tufts, Blue Cross Blue Shield, HMO, or PPO, and you get your medical services through that plan, okay? Medicare A and B are no longer your primary coverage. Your primary coverage is the plan, okay? And you have to stay in the plan's network and get your coverage through that plan. Okay, we all understand that? You guys are a knowledgeable audience. I've been here for about 7 years, and you're picking it up real good. Okay, so let's talk about the plans that are available a little bit, okay? Medicare, at the Medicare Advantage plan, they have one HMO. The premium is $0. They have 2 PPOs. The premiums are $0 to $57. All plans include medical and prescription benefits. Medical out-of-pocket maximums are for the HMO is $6,700. For the PPOs, they're $6,700. And these are important. Medicare out-of-pocket maximums, that's the most you'll pay in the plan for medical services, and after you pay that much during the year, the rest of your services are free. It's a high level, though. If you're spending $6,700 in co-pays and deductibles and stuff like that, you're having a bad year, to put it mildly. So, just be cautious of that. So that co-pay is what that out-of-pocket maximum is important. Some plans have their out-of-pocket maximum, and they're not as high. Blue Cross Blue Shield of Massachusetts has 4 HMOs. Premiums are $0 to $292. They have 3 PPOs. Premiums are $0 to $262. All plans include medical and prescription benefits. Medical out-of-pocket maximums are the HMOs are $3,400 to $9,900, and the PPOs are $3,400 to $6,700. And again, you have some lower out-of-pocket maximums with the Blue Cross plans, and just have some higher out-of-pocket maximums with the Blue Cross plans as well. Needless to say, the higher out-of-pocket maximums go along with the cheaper plans. Okay, so if you're getting a cheaper plan, you're going to pay a higher out-of-pocket maximum. Okay, if you get a more expensive plan, that out-of-pocket maximum is going to be a little lower, or a lot lower in some cases. Okay, all right. Fallon Senior Plan. A lot of us have Fallon. We have 5 HMOs. The premiums are $0 to $275. We have 1 HMO POS. The premium for that plan is $103. They have plans with and without drugs. You can get a plan from Fallon without drug coverage, okay? We don't recommend it. You can't get it really, but you have to get if you're taking medications, you have to get your medications from your HMO plan if you're in an HMO or a PPO. Okay, the only exception is some folks may be veterans, okay, and they're getting their drugs through the VA system. Okay, that would be an exception to that requirement. Okay, medical out-of-pocket maximums for Fallon Senior Plan. The HMOs are $3,400 to $6,700, and the HMO POS is $5,000. And again, the rule of thumb is that if you're paying for a zero or a cheaper plan, that out-of-pocket maximum is going to be higher. If you're spending more money for a premium, the out-of-pocket maximum is going to be lower. Okay? Do we understand that? Okay. Harvard Pilgrim Stride Medicare Advantage Plan, 3 HMOs, premiums are $0 to $190. All plans include medical and RX benefits. Medical out-of-pocket maximums, HMOs are $3,400 to $6,700. Okay, that's for the Harvard Pilgrim Stride program. Then we have Tufts Medicare Preferred Medicare Advantage plans. There are 7 HMOs. Premiums are $0 to $185. They have plans with and without drug coverage. The medical out-of-pocket maximums are HMOs are $3,400 to $6,000. Again, the more you pay for premium, the less that out-of-pocket maximum is going to be. All right? Okay, let's go to the slide. Five-star SEP, it's on page 4. Okay, if everybody can go back to that one. 5-star SEP on page 4. Blue Cross prescription drug plan and Tufts Medicare HMO plans have been granted 5-star status for 2019. This means the plans have an SEP, okay? What this means is this: it's a very, very good benefit, okay? You can join a Blue Cross drug plan or a Tufts Medicare Preferred Medicare Advantage plan anytime during the year, okay? Because it has 5-star status. This is a big deal. across the country, I was shocked by this myself when I saw it. There are only 14 plans in the whole country that have 5 stars as far as Medicare Advantage plans go. 14. There are only 4 Medicare Part D plans, standalone Part D plans that have 5-star status. We're fortunate to have one of the drug plans and one of the Medicare Advantage plans in the whole country. This is the big deal because sometimes people can get jammed up and not have coverage, or they may lose coverage for some reason or another, get into some kind of jackpot or another, and they need coverage. Well, guess what? They can get it in Massachusetts. Okay, they can pick up this coverage in Massachusetts if they need to. It's a wonderful benefit. It really is. It really is. Part D prescription plans, there are 26 plans offered in 2019. Premiums range from $14. $14 plan is a WellCare Value prescription drug plan, up to $127 for a Blue Cross plan. Beneficiaries receiving extra help, and some beneficiaries receive extra help with their drugs if their income is low enough. And there are 7 plans with premiums that will be reduced to 0 if they receive extra help. And we use the Medicare Plan Finder tool online to compare premiums, deductibles, and co-pays. And that website is there, too, if you'd like to take a look at it. You are a family member. Plans will limit, this is a new deal, too, relatively important. Plans will limit initial opioid prescription fills for treatment of acute pain to more than 7 days' supply. This is in response to the opioid crisis and all that going on with people being addicted to drugs and hitting medicine cabinets and stuff like that. So this is something they're trying to do to help with that, okay? So pharmacists may need to consult with the prescriber before filling some opioid medications, which may delay prescription readiness. All Part D plans have opioid monitoring staff. So again, this is something that may come up, okay, if you're taking an opioid-based prescription, that you're going to have to work with your pharmacy and your provider on, okay? You'll have to work with your provider and your pharmacy on. There's some Part D plan changes. First Health Part D and Symphonex, these were Part D plans that were around. I don't know if anybody has them. If they do, they're going to be changed automatically to a different plan. The First Health Part D will be changed to Aetna Medicare RX Value Plus. The Symphonex plan will be changed to AARP Medicare RX Saver Plus. You would have received a notification on this sometime in September or October that you're going to change your Medicare Part D plan. Okay, now, am I where I am? I am where I am. Are there any questions? Any questions at all? Do you understand what I said? I don't see any heads shaking. I don't see any of this. Huh? Okay. Listen, it's been a pleasure to come here, but this is probably my 6th or 7th year down at Uxbridge doing this. It's been a pleasure. I don't know if I'll be back next year. I might. I'm cutting back a little bit. I'm trying to come up with an exit strategy for work, so we'll see what happens. But it's always been a pleasure to come down to Uxbridge, and I'm happy with our announcement today that we will be having a regular counselor down here on a regular basis, and to do counseling for you and get those services for you. Okay, so the gentleman has a question. Page 7. Okay, Medicare Advantage plans. You want to make sure your doctors and your drugs are covered in a Medicare Advantage plan. Very important. That's the most important piece of it. Okay? You need to make sure your doctors take the plan. If you're in a plan now, you would have received notice if there was something changing. Compare premiums, copays, and deductibles, and annual out-of-pocket maximums and extra benefits. Sometimes you're going to get extra benefits from some of these plans. We'll give you this, we'll give you that. That's nice. Salesman might call you. We'll give you this, we'll give you that. You're going to do this for you, going to do that for you. Guess what? Your doctor might not be covered. No good. A Medicare Advantage plan, your doctor has to be covered. Okay? If your plan gives you some extra bennies, wonderful. But don't just change plans because you're hearing somebody's getting extra bennies. Okay? You need to make sure that in your plan, your doctor takes your plan. That's the important part. You don't change plans for extra bennies unless your doctor comes along with the benny. Okay? Do you understand? Very important. You're going to see this stuff now. Okay? They're doing a lot of stuff to entice people to join different Medicare Advantage plans. All right? But the important thing about plans is, again, is your doctor covered? Any doubt at all, talk to a Shine counselor. Yes, ma'am.
I didn't quite understand what you said about Blue Cross Blue Shield.
About Blue Cross Blue Shield?
Blue Cross Blue Shield bronze.
Bronze, okay.
Am I going to expect pain?
No, you're going to get, for Blue Cross Blue Shield Bronze, you're going to have an small increase in the premium to $197, and it's going to work the same way it always has. Okay? It's going to work the same way it always has for this year. All right? Anything else? Okay. I'll hang around a while, and Pat will hang around. And if you have any questions, feel free. Thank you very much.